Hello, I'm Dr. Denise Hyland, and we are filming this evening from the laser room in St. John's, Newfoundland, the procedure known as the Madonna eye lift. Now, this is a procedure using the fractional carbon dioxide smart side laser, and the purpose of doing this treatment is for patients that have droopy upper eyelids and a lot of extra or wrinkled skin below the eye and some crow's feet, and the laser will tighten the skin and lift the eyebrow for the desired result. Now, it is a procedure that has to be repeated between 3 to 5 times for the optimal result, and I'm going to introduce you to our patient this evening, Sharon, and we shall see how this procedure may benefit Sharon. So, hello Sharon, how are you feeling today? Great, okay. So if you don't mind, I'm going to allow our viewers to have a look at the problem area that we're going to treat today. So you have noticed that you have a little bit of a double eyelid, isn't that right? And maybe some mild little wrinkles below the eyes, and perhaps a little bit of drooping of the upper, the brows, right? So rather than do a surgical procedure, we're going to try this non-surgical resurfacing carbon dioxide laser, the smart side laser, and see if we can fix the problem for you. Now, the areas that we're going to focus on here is we're going to do a little light resurfacing of the eyelid itself, and then this sort of loose skin that's between the eyelid and the brow, when the laser resurfaces, that skin is going to shrink. And we're also going to resurface the brow above the forehead and above the brow. And again, with the shrinkage that happens following the laser treatment, you're going to see a little bit of lifting of the eyebrow, which is again going to diminish that heavy look of your upper eyelids. Now, under the eyes, you just have some very, very fine little lines here. Not too much in the crow's feet, but we're going to go just under the eyes, and where there's a little tiny little bit of darkness just under the eyes there, dark circles, we're going to resurface that too, and I think we should do quite well. Now, normally this procedure takes between 3 to 5 sessions, and we'll do that at intervals of 2 to 3 weeks apart. And the good thing is we're not going to need any injections. We're just going to put a local anesthetic gel on you and let you have that on for about 15-20 minutes, and that will numb the skin so that you'll have, minimal or no discomfort during the procedure. So the other thing that we're going to do as well is, because we're going to be resurfacing the eyelids, we're going to use a corneal shield, which is like a steel contact lens that's going to fit over the eye and protect that, so there's going to be no problem with the laser. So that's going to keep the eyes going to be well protected. Okay? So we'll get started then. Do you have any questions or?
No. Looking forward to the results.
Well, now, as we discussed before you came in tonight, there's going to be a little downtime for you. The first couple of days, and the seeing as this is a Friday evening, you have the weekend off, but the first couple of days you can expect a little bit of swelling of the skin around the eyes, a little bit of redness, and a little bit of flaking. And we're going to use a nice moisturizing ointment for those first 2 days. And then over the next 3 to 4 days, there's going to be just a mild little bit of pinkness around the eyes and above the eyebrows, which you can then wear some makeup to disguise. So you'll look fine going back to work on Monday morning. Okay?
Great.
All right.